Well, it's time now for our Africa Health Network report. Joining us is Africa 54's Linord Moudou. Hello, Linord.
Hello, Vincent, and hello, everyone. A new report is hailing what officials describe as significant progress in the fight against HIV/AIDS epidemic in Eastern and Southern Africa. The report prepared by the UN AIDS Agency says AIDS-related deaths have declined dramatically and the number of new infections has decreased, a direct result of more available treatment. Now joining us via Skype from Johannesburg, South Africa, to tell us more about the new report is VOA's Anita Powell. Hello, Anita.
Hi.
So you attended the press conference this morning with regards to this specific report. Can you give us a sense of this good news that they were saying earlier? Break down the numbers for us, please.
Sure. It was an unusual event. I've been a journalist in Africa since 2007, and I don't believe in good news. But this press conference managed to warm even my hard little heart because there was very little bad news to be found in it. Some of the results that they found in the report are that AIDS-related deaths in Southern and Eastern Africa have decreased by 40%, nearly 40% since 2005. And that in some countries it's been even 50%. Also, new infections are going down in some countries. In 7 countries that they mentioned, it's more than 50% decrease in new infections. The one sliver of maybe not so great news is that they found that young women are still at risk disproportionately. For example, young women's HIV rate is 4.5%, which is twice the rate of young men. So that is still worrying. But it was very interesting to watch these health ministers talk about their country's different strategies for dealing with HIV/AIDS and their successes in doing so.
Now, South Africa is one of the countries with a significant AIDS burden in the past has been criticized about the way they were approaching the HIV/AIDS pandemic, but it seems like recently there have been some good news in the country. Can you tell us more about that?
Sure. The health minister, Dr. Aaron Motsoaledi, alluded to this. His predecessor believed that AIDS could be treated with herbal remedies, including garlic and beetroot. And he said that, under his rule, it was going to be evidence-based, a scientific approach to HIV. And that's what it's been. And as a result, antiretrovirals have been more available to South Africans, and the government has taken it on as the epidemic that it is. And he says that they've seen results in the last 3 years, including a decrease in AIDS-related deaths and more people on ARVs. And significantly, he said, it went from being 2 million people a year being tested for HIV to 16 million people a year being tested for HIV, including the president, who's made his results public. And it's quite an affair whenever he goes in and gets tested.
So in general, what are they attributing these good results to?
They're attributing them to a huge increase in availability of antiretroviral drugs. In 2005, about 625,000 people were on ARVs. In 2012, it was 6.3 million. And there have been a lot of factors in that. The South African health minister was saying that one of the struggles that South Africa faced was making sure that the drugs were affordable. And South Africa has now gone from being the country that pays the most for antiretroviral drugs to the country that pays the least. And that's been an adjustment for all of these countries, just figuring out how to get the drugs, how to disseminate them. In Ethiopia, for example, a lot of these treatments are disseminated through what they call I just totally blanked out on that, but they're local health workers. Okay. They're health extension workers, that's what they're called. Okay. And they're high school graduates with 1 year of training who go into communities and deal directly with patients. They're not doctors, they're not nurses, they're targeted on HIV.
Unfortunately, that's all the time we have. Anita, thank you so much for your report. We appreciate it.